If you're a man and you've noticed that your visits to the bathroom are more frequent, that your urine stream is weaker, or that you just can't empty your bladder completely, this might be the most important thing you've heard in a long time, because there's a simple and fundamental mistake that most men make every time they urinate that over time may be silently damaging your prostate and progressive. It's not a mistake that you learn in a medical school. It's not something they talk about in magazines. It's an unconscious habit. But when you correct it, the impact on your prostate health and quality of life can be dramatic. It doesn't come from a pill bottle or expensive treatment. It comes from understanding how your body really works. And in my clinic, I've seen how this simple adjustment has helped men reduce the urge to urinate, achieve a stronger flow, and most importantly, protect the health of their prostate for the future. I'm Dr. Patricia Smith, a professor of urology and men's health specialist with more than 3 decades of experience. I've worked with thousands of men who by the time they reach their 50s or 60s find themselves dealing with the symptoms of an enlarged prostate, or what we call benign prostatic hyperplasia. But when we focus not only on the symptom, but on the habits and biological mechanisms that affect it, something incredible happens. The body begins to heal, trips to the bathroom are reduced, the pressure decreases, the quality of life returns. And this is where it gets interesting, because most men assume that the problem is purely an age issue. But the truth is that there is another system quietly working behind the scenes and an everyday mistake that is compromising it. It's the bladder emptying system. The complex dance between your bladder and your prostate and the way you urinate is directly affecting both. So in this video, I'll reveal exactly what that mistake is, why it's so harmful, and give you 3 additional, simple, and practical tips you can implement today to start protecting your prostate. Stay with me because you don't want to miss out on this vital information. 1. The silent error that is damaging your prostate. I've been sitting in front of hundreds of men, good, hard-working men, who look me in the eye in frustration and say, "Doctor, do I get up 5 times a night, or can I barely start urinating, or is the urge so strong that I'm afraid to leave the house?" But often the root of your problem doesn't start with the prostate itself. It starts with a bad habit that has built up over decades, and that habit is the rush to urinate. Most men get up, go to the toilet, and in their eagerness to finish quickly to get back to whatever it is they were doing, they push to force the flow of urine or else stop as soon as the stream weakens. This act, pushing or not finishing emptying, creates unnecessary pressure. It's like trying to squeeze out a tube of toothpaste with the tweezers. Constant exertion not only overloads the bladder, making it weaker over time, but it also puts retrograde pressure on the prostate. Think of the prostate as a soft, elastic sponge. The constant strain of the bladder against the prostate when trying to push urine, and the residual urine generated by the bladder when it does not empty completely is like repeatedly squeezing that sponge. Over time, that chronic tension contributes to inflammation and gland growth. The detrusor muscle of the bladder, which is responsible for contraction, becomes fatigued, and as a result, the bladder can no longer empty completely. That urine that remains, what we call residual urine, becomes a breeding ground for bacteria, increasing the risk of urinary tract infections and further aggravating prostate symptoms. It's a vicious cycle. You push, the prostate becomes inflamed, the bladder weakens, it does not empty completely, and the problem gets worse. The solution is simple and relies on patience and proper technique. Just don't push, take your time, let the flow start naturally, and most importantly, stick around for a moment after you feel like you're done. Relax, lean forward slightly, and wait for your bladder to empty. This small tweak can make a huge difference, but it's not the only thing you can do. The real magic happens when you combine this change with other supportive habits, and that's what we're going to talk about next. Because the health of your prostate is not an event, it's a process. And science has discovered that there are 3 other simple, practical things you can start implementing today. 2. The power of double mixing. You'd be surprised how often a man does the right thing, but in the wrong way, and ends up feeling like nothing works. I've seen it with diet, with supplements, even with mixing. That's why I always remind my patients that the how matters as much as the what. In addition to not pushing, there is a technique that I have taught hundreds of men with excellent results. We call it the double mixture, or the 2-stage mixture. The idea is simple. First, urinate normally, without haste, without pushing. When you feel like you're done, instead of rushing to wash your hands and walk out, sit down or stay in a relaxed posture for a moment. Lean gently forward, or if you're standing, lean over a bit. Wait 10 to 20 seconds. With this simple act, you'll often find that your bladder has a second chance to empty. It's as if the trousseau muscle, when relaxing for a moment, realizes that it still had a bit of work to do. This second mix is often the key to reducing residual urine, which in turn decreases the urge to urinate as soon as you get out of the bathroom. By eliminating that stagnant urine, you also reduce the pressure on your prostate and the risk of infections. I remember one of my patients, a 65-year-old lawyer named Juan, who told me that this technique changed his life. He told me that he used to feel a constant urgency. After implementing the double mix, urgency and overnight travel decreased. This is not magic, it is neurobiology. You're teaching your bladder to work more efficiently and communicate better with your brain. This little pause, this little moment of awareness is a powerful act of self-care that puts you back in control and just waits, because next I'm going to show you how something as simple as the way you sit can change the game completely. 3. The myth of urinating standing up. This is a topic that often brings a smile to my patients' faces, but the science behind it is serious and compelling. For most men, peeing standing up is a ritual, an intrinsic part of their manhood, but the truth is that for prostate health, peeing sitting down is almost always superior. And don't get me wrong, there's nothing wrong with peeing standing up if you're a young, healthy man. But as the prostate begins to enlarge with age, the angle of the urethra changes. Urinating standing up may not allow the bladder to relax and empty completely. On the other hand, urinating sitting relaxes the pelvic muscles, opens the angle of the urethra, and allows for a stronger and more complete flow of urine. Several studies have shown that men with symptoms of benign prostatic hyperplasia who urinate sitting down have a shorter mixing time, a higher peak urine flow, and a significantly lower amount of residual urine compared to those who urinate standing up. This change, while it may feel strange at first, is a powerful act of support for your prostate and is not a matter of masculinity, but a matter of pragmatism and health. One patient, a carpenter named Pedro, told me that it took him a week to get used to urinating sitting down, but now it's all he does. He said, "Doctor, I don't care what they say. My trips to the bathroom have been cut in half and I don't wake up at night anymore. If this helps me, I will do it without hesitation." That's the mindset we need. A focus on health, not traditions. But there's still a final piece to this health puzzle. Prostate, one that most men completely ignore and is right in your diet. 4. The power of anti-inflammatory foods for the prostate. We've talked about the importance of peeing technique and posture, but all of this works best when we also support the prostate from within. As a professor of urology, I have seen that chronic inflammation is a key factor in most degenerative diseases, and benign prostatic hyperplasia is no exception. Just as constant pushing generates mechanical stress, an inflammatory diet generates biological stress. That's why the fourth and final tip is the most holistic and powerful. Support your prostate with foods that fight inflammation. Studies have shown time and time again that diets rich in fruits and vegetables that contain key antioxidants and vitamins are directly linked to a lower incidence of prostate problems. Think of foods like lycopene found in cooked tomatoes. Lycopene is a powerful antioxidant that has been shown to help reduce inflammation and prostate size. Also think about zinc. The prostate has the highest concentration of zinc in the entire body, and zinc is vital for normal prostate function. You can find it in pumpkin seeds, walnuts, and beans. And finally, don't forget the omega-3 fatty acids found in salmon, sardines, and walnuts that are known for their potent anti-inflammatory effects. It is not a strict diet, but about making small changes. Start by adding an extra serving of vegetables to your meals, or make nuts a daily snack, or eat a bowl of oatmeal with pumpkin seeds in the morning. They are small acts, but when combined with the right mixing technique and proper posture, they create a virtuous circle of healing. When you nourish your body with what it needs, it has the ability to heal itself in ways you never thought possible. And now that you understand the 4 pillars of prostate health, it's time for us to tie it all together, because in the end this isn't just about your prostate, it's about your life, your legacy, and what kind of man you still have time to become. Let's talk about it. If there's one thing I hope you'll take away from this, it's that your body hasn't given up on you. Even if you've felt helpless, frustrated, or embarrassed by prostate symptoms, the truth is that there's still an opportunity for change. We talked about the most common and silent mistake that many men make, that of pushing, and how to correct it with patience. And a simple technique, I revealed to you the power of double mixing, a practical way to ensure that your bladder is completely emptied. I shared the truth behind the pose, explaining why peeing sitting may be the best habit for your prostate. And finally, it walks you through the importance of nourishing your body with anti-inflammatory foods, giving your prostate the support it needs to heal. I have dedicated my life to helping men regain their strength, their connection, and their sense of self. And I can tell you with absolute certainty, it's never too late to start over. You don't need to be perfect. You don't need to do everything at once. You just need to start with a small adjustment, a small intention, and a willingness to believe that change is still possible, because it is. I've seen it, I've lived it with my patients, and now maybe it's your turn. This is more than medical advice. It's a daily reminder that you're still alive, you're still capable, and you're still very much a man. The choice is yours. If this video gave you hope or taught you something valuable, please take a moment to like, share, and leave a comment below. I read them all. Your voice helps this message reach more men in need. And if you'd like to support the channel so we can continue to create honest, science-based content, please consider making a small donation. Every little bit makes a difference. Yes.